Fairview Health Services has won national recognition for its efforts to address community needs and social determinants of health. This week, we talked to Diane Tran, the System Executive Director of Community Health Equity and Engagement at M Health Fairview, about what won a major hospital honor this summer. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Abby Mochtig. In this episode, the MHA's Tim Nelson talked to Diane Tran, the System Executive Director of Community Health Equity and Engagement at M Health Fairview, about the Foster G. McGaw Prize, and why Fairview got that recognition after years of working to address health challenges in the community and the social determinants of health.
Fairview was recognized this year with a national award from the American Hospital Association for community support. I think a lot of people think of hospitals as sort of places to get care. What's the value in reaching out outside the walls of a hospital?
So research shows that increasingly health is more impacted by things outside of our hospital and clinic walls than inside. So it is, wonderful that we provide this excellent, culturally relevant clinical care and that we partner that critical care and support with outreach, connection, and resources in the community. Increasingly, zip code is a greater predictor of health outcomes than genetic code. And so we want to have a more comprehensive strategy when we think about what is really going to serve the health of individuals, families, and community, not just in the day-to-day, but over the longer term. And so that requires some of those upstream investments to build trust, relationships, a shared vision for what health is, and to recognize that we are one very important part of the puzzle and that we are one part of the puzzle and really need additional partners to help bring this vision to life.
So I mentioned the AHA recognized Fairview's efforts earlier this year. What programs specifically are drawing that kind of attention? What's Fairview doing?
We're really honored to receive this award. Some of the key programs that are being recognized include our Eastside Health and Wellbeing Collaborative, an initiative that Fairview has convened for over 10 years with about a dozen community partners on the east side of St. Paul, a place-based initiative where we work to co-design and co-implement culturally responsive and sustaining solutions that have served community members and partners, as well as our health system over time as we've learned how to integrate and create bridges between those programs and our own healthcare system and staff.
And what does that look like on the ground? What's going on over there?
The Eastside Health and Wellbeing Collaborative about 10 years ago formed when we reached out as a health system to community partners to understand what are the health needs on the east side of St. Paul and what are the opportunities when we think of the assets of longstanding community leaders, a diversity of cultural groups and organizations, faith-based entities, social service agencies, and other community leaders really committed to that place and its future. And so through a series of conversations, we came to understand that we could work together, and we identified a few key issues that we could work on to practice how it is that we could partner and collaborate. Those were around healthy food access and nutrition, as well as mental health and stress resilience with an eye towards culturally responsive supports. And we then went into a co-design process for about 6 to 8 months, meeting every other week to be able to have time through community facilitators to develop these ideas that we as healthcare wouldn't have thought of, but that really then did address those issues to help bring food skills through a make-at-home meal kit program that featured culturally reflective recipes from the communities on the east side of St. Paul, and then cooking demonstrations and other resources around building up excitement and energy around learning food skills together to then decrease, food purchased out of home, and then to increase understanding and better self-confidence with working with fresh food and produce. The Cultural Brokers program was then also developed by the community partners at the table, reflecting the importance of a bilingual, bicultural navigator who worked full-time at the health system, but also can really focus on the challenges that individuals and families encounter when they are trying to promote their own wellness and find the next solutions.
So this isn't just an interpreter, it's someone with some other skills. bringing to the table.
Yeah. And the time and the ability to support people. It doesn't require an extensive intake or particular diagnosis, but really someone who can help reach people where they're at and move them to the next step to increase their own sense of navigation and self-sufficiency so that over the long term, they're able to know the resources and then to be able to make those connections and support others to do the same. So those were the 2 interventions designed by the collaborative. Those have sustained over the years. They've continued to be embedded within the different organizations where they're located, and then also further built into Fairview so that we also have the ability to access and utilize those resources, supporting our providers and our care teams to help to bridge connections for our patients and families and community.
So that's on the east side. What else is going on?
Yeah. The collaborative, the cultural brokers, and then our food is medicine Fair Table program were recognized, as well as 2 other programs. One of them is the Minnesota Immunization Networking Initiative, also known as MINI. And this is our team of community clinical nursing and healthcare providers who are able to be out in community place settings that are trusted by folks who might have barriers to accessing traditional healthcare in our clinic and hospital settings. And so the opportunity to be out in church basements and at mosques and different community festivals or at farms, that it really is reaching folks where they're at and bringing services such as flu shots and COVID shots or Mpox vaccines, hepatitis A when there's been an outbreak, blood pressure screenings, that all of these things help us to be a resource to community organizations and partners, and then to help community members access these valuable resources in a place, again, where it's easy for them to do so and they can have a greater sense of trust and confidence in the process and experience. And MINI has been around as a collaborative for 19 seasons. And so we're coming up on our 20th flu season and year. So it's been a long-standing collaborative that has received national recognition and support from the CDC and from the New England Journal of Medicine. The last program recognized was our Health Commons. So these are drop-in wellness, hospitality-based health centers in communities. We have 3 of them currently, all in partnership with Augsburg and with local partnership organizations. They're located in Cedar Riverside neighborhood, in near North Minneapolis, and then on the east side of St. Paul with the Sonai Foundation at Conway Recreation Center. And these are places that are accessible, that folks can drop in for Zumba or other wellness classes, where they can receive free nurse or retired physician consultations, places where in their own language and with people who reflect their culture are able to receive healthcare services, but also a sense of community and connection, helping to break social isolation and to really see themselves as a part of that local neighborhood and community.
You're talking a lot about other people here. Obviously, you can't be experts in food preparation or Zumba classes or things like that. How does partners play into this?
Partners are critical for us to be able to do this work. We recognize again that as a hospital system, we have a great deal of resources to offer, and it's necessary to have other community organizations and trusted messengers and leaders with which we're able to start to build relationships and trust with the community. So we think of our partners certainly as some of the community leaders where we can learn and gather insights from, where we're able to go and set up a vaccine clinic at their, weekly event or at a big festival that they might be offering, or that we're able to bring training to their staff and to their team members around psychological first aid, or to be able to partner to bring bike helmets to some of their local community events. We have resources that we can bring, but we need the partners and the places to know that there's a shared need for that and that we could be of value to them, so that we have that sense of reciprocity. We also, through our Food is Medicine and Fair Table programming, recognize the importance of our farmers and growers, and have really, since the beginning, worked to purchase from local farmers, including the Hmong American Farmers Association, the Women's Environmental Initiative, Sin Fronteras in the past, and Naima's Farm now, so that we are able to reinvest back into the local food ecosystem for purchasing of foods that really reflect the diversity of the cultures of our patients and the community members who receive our food boxes and food supports, so that that increases their enjoyment, their sense that these programs are meant for them and their wellness. And so that aspect of investing back into farmers, as well as the opportunity for young people to be able to help package some of the food that we distribute as a workforce development opportunity in the food service and food industry, are really critical ways that we see partnership is both about the way we serve as an anchor institution, as well as how it is that we reflect what we think of as the healthcare services we provide.
Now, consumers, insurers, providers are all struggling with the cost of care right now. I think some people would sort of question if this is the right time for these kind of investments. Why is it important that this is happening now and at Fairview?
Frankly, some would say that this work has been long overdue, that because of some of the disinvestment we've seen from different areas that really support public health and preventative care and education upstream, so that people really do understand their own ability to be in charge of or feel confidence around their own healthcare journey or that of their families and those that they care for, that there's increased need now more than ever to be able to offer those resources so that we are seen as working in partnership. Healthcare, we believe, is not meant to do to, but to do with or alongside. And so as we think about creating the conditions and the resources that can equip patients and families and community with these resources, we know that's an investment in how it is that we are partners with our patients to be able to support them in how they care for themselves in partnership with us, to be able to do the pieces that make sense for community care and health and wellness, so that when they are in clinic, it's that we're seeing them for the quote unquote right reasons at the right time, because we've taken the time to understand where our shared responsibilities are, and have supported them to be able to know that they can take care of themselves, and that as it's needed, we are really there to be, specialized in the care that's needed for them. And one of the key reasons Fairview is doing this now is because up to 80% of what impacts our health and well-being is actually what takes place outside of our hospital and clinic walls. So it's really critical that we also create solutions in partnership with community to address the pieces that are outside of the care that we provide.
Minnesota also has a long history of nonprofit social services and healthcare, kind of in the water here. Why is this happening at Fairview? Why is Fairview getting this national attention?
I've heard our CEO say time and again, this is in our DNA. And since its founding, Fairview has been committed to community. We've been doing our community health needs assessments since before they were required, as a way to understand what is happening in our community, to be aware of the landscape, to understand what the most pressing needs are, and to identify the opportunities we have to work together. It is a challenging time right now for many in our communities who already may have seen themselves as outside of accessing traditional systems, and who feel fear and uncertainty, whether that's as an individual and family or as a community organization and partner providing services or resources. There is a lot that our communities are contending with when it comes to stress and fear and concerns, all of which challenge their ability to be well and to be connected. And at Fairview, because we believe in the importance of caring for others without regard, as we think about some of the key founding principles of our organization, that it is our time to act, it's imperative, and that we are doing this work not out of being charitable, but really as being an anchor institution. It's our responsibility as a large employer with 34,000 employees, the fourth largest employer in the state, to know that the way that we do, our business of care can really also invest back into the community. Certainly through providing resources and services and programs through our community health improvement initiatives, but also through the way that we hire and reflect our communities in the care and operations that we provide, that when we are purchasing from our local businesses and farmers, that's another way in which we invest in local wealth building and therefore health building, and that utilizing our investable assets can be another resource for investing back into the community, into affordable and stable housing, into other key systems change and scale solutions that really an organization of our size is able to do, and that we want to be able to step into the responsibility and opportunity to be able to commit to as an anchor institution that does better when its community does better.
Now, some of these programs you've said have been around for more than a decade, decades even. Mm-hmm. I guess the question is, are you seeing results? Is there something out there that's telling you that this is working and it's the right thing?
Absolutely. We see program level outcomes from the programs that we manage, including our cultural brokers, which continue to demonstrate results of 98% and or in the high 90s about self-reported satisfaction and appreciation for the cultural workers that work with them and navigate some of these issues. We've seen them also report the own sense of confidence that they have increased when thinking about issues of self-navigation and assurance in that regard. So our mini program is a collaborative that was launched in 2006 and led by Fairview, and it's supported by over 200 local partners. Some of the community reach that we've seen over time is that there have been 200,226 vaccinations provided, and since the COVID pandemic, we had hosted 1,942 COVID vaccination clinics in particular, resulting in providing over 68,454 vaccines. And of note, 80.5% of our clients have identified as African or American Indian or Alaska Native, Asian or Asian American, Black or African American, Hispanic, Latinx, Native Hawaiian, or other Pacific Islander. So just to show the kind of reach and access that we're creating with these vaccination clinics.
Those are some big numbers.
And 42.8% indicated a language other than English as their preferred language. So really just to reflect that this is some of the way that we're able to, by being mobile and doing this outreach and reflecting in our staff, the community that we're looking to serve and connect with, we can really receive results that might be different than and supplementary to what our health system is doing day to day in our hospitals and clinics.
Well worth the recognition. Congratulations on the prize, and I can't wait to hear more about what Fairview does.
Thank you. We're so honored to be here and have the chance to share.
Again, that's Diane Tran, the System Executive Director of Community Health Equity and Engagement at M Health Fairview. I'm Abby Mochtig, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.